Hello, my name is Lori Rigby, and I'm in speech 191. This is my informal outline, front and back. Do you know someone who has painful or absence of menstrual cycles? Do they suffer from infertility, increased hair growth, ovarian cysts, acne, weight gain or obesity, high cholesterol, high blood pressure, male pattern baldness, or thinning hair, pelvic pain, or insulin resistance or type 2 diabetes? The U.S. Department of Health and Human Services states about 1 in 10 young women has irregular periods due to polycystic ovarian syndrome, or otherwise known as PCOS. It can occur in girls as young as 11 years old. PCOS is the most common cause of female infertility. It is also the leading cause of insulin resistance and type 2 diabetes in women, according to American Diabetes Association. Polycystic ovarian syndrome is a health problem that affects women's menstrual cycle, ability to have children, hormones, especially insulin, heart, blood vessels, appearance, and typically have levels of androgens and may have small cysts on their ovaries. With PCOS, women typically have missed, painful, or irregular periods, which is caused by the ovaries not making enough hormones it needs to have her eggs release to full maturity. Follicles may start to grow and build up fluid, but no one follicle becomes large enough. Instead, the follicles remain as cysts. Since no follicle becomes large enough and no egg matures or is released, ovulation does not take place and the hormone progesterone just does not get made. Without progesterone, a woman's menstrual cycle is irregular or absent. The cyst makes male hormones, which prevents ovulation. Researchers believe that these cysts could be caused from the body having too much insulin production. Insulin is a hormone that controls the change of sugar, starches, and other foods to energy for the body to use or to store. For many women with PCOS, too much insulin remains in the body instead of using it for energy. Since the body is not using the insulin for energy, the body moves it into the bloodstream and stores it as fat. This, in return, causes fatigue, extreme weight loss. Excess insulin also appears to increase in the production of androgen. And as you know, androgen is a male hormone, and it's made in the fat cells, ovaries, and in the adrenal gland. Levels of androgen that are higher than normal can lead to acne, excessive hair growth, weight gain, and problems with ovulation. Increased hair on the face, chest, back, toes, thumbs is a condition called hirsutism. Hirsutism eventually causes male pattern baldness and can be treated with certain medications. Polycystic ovarian syndrome that affects a woman's menstrual cycle, it also affects the ability to have children. It affects her heart, blood vessels, appearance, and with the appearance, many women frequently get depression or anxiety because they can't handle the changes in their bodies. One particular change is the moon face. The moon face is a rounded and flat appearance, and also she has a rounded abdomen and is typically called the apple shape, and this usually causes a lot of depression for these women. Generally, she'll also have painful, irregular, or missed periods. It causes infertility. Fluctuations in insulin causes aches and pains and extreme weight gain. Androgens also cause weight gain and unwanted hair. These symptoms can all be reduced by taking birth control pills, diabetic agents such as metformin, and in the case if a woman wants to become pregnant, she would need to then take fertility medications. If you know someone with any of these symptoms, refer them to their medical doctor or a reproductive endocrinologist. They can then be tested. They can have a 4-hour glucose tolerance test, and that would show if they have insulin resistance, which would then prove to be PCOS in the long run. So if you do know anyone with these symptoms, please have them go see their doctor. Thank you.